and we are so happy to be here at such a beautiful event. Thank you, Kiana and Angie and Brian, everybody that's worked so hard to get all of this together. I think we can give them a round of applause real quick. So, endometriosis can be a debilitating, destructive disease, and most commonly it's called something benign, which I think is really a terrible word to call this disease, right? It's a misnomer, and it's something that can destroy people's lives, their fertility, their bowel function, their kidney function, their sexual life, and even in severe cases we'll hear about tonight, even their lung function. So calling this disease something benign, I think really is a detriment for patients and for the community and for even reimbursement for surgery and everything that this stands for. And it really belittles what people go through. Unfortunately, that's how it's seen. As a surgeon standing in the OR for hours on end and cleaning this disease, I can attest it's no way a benign disease. We may spend anywhere from 2 hours on a case to 14 hours on a case, depending on the amount of destruction it's caused in the pelvis and the surrounding organs. And when we fight with insurance companies for approval and try to explain the hours that we stand there reconstructing to normal anatomy as opposed to a 5-minute burning procedure or putting the patient on hormone suppression, they really don't want to listen. And I even offered to send them videos of what we do, and they don't want to see them. So unfortunately, it's very frustrating, even for us as surgeons, to deal with this and to try to get it approved and take care of everyone. But don't let this scare you. There are ways to get past it and to live your life without it, but we'll talk more about this as the night goes on. As a patient with endometriosis, it can be tricky to diagnose, and this is because everyone's story is actually very different and unique, and they may feel their endo a little bit differently than what their friend or their mother or their sister may have felt. So whether it affects the bowel or the bladder or it's close to the ovaries will impact how your symptoms show up and how you feel. And this disease by nature, like Kiana mentioned, it's implants that grow elsewhere in the pelvis, not usually always just around the uterus. And so these lesions can be actually really tiny, 1 to 2 millimeters, and people that have trained for years with Dr. Sechkin and will see these lesions and they'll say, oh, you don't need to bother with this little thing. But every lesion is important, and every lesion can be overlying a nerve and cause pain, or later embed deeper and cause destruction. And it's definitely a disease that causes and is surrounded by a lot of inflammation. It's not autoimmune, but it similarly attracts inflammatory cells to the area that causes deep scarring. These symptoms can be bladder pain, frequency of urination, heavy periods, clots with their cycles, ovarian pain, rectal pain, diarrhea, constipation, the list goes on, gas, bloating, leg pain, chest pain, any number of things that can be attributed to the cycle and have some sort of hormonal correlation. Many women with endo will have terrible periods starting from their teenage years, but not all of them. Like Kiana said, not all endo patients actually have horrible periods, and so for many women, they could miss diagnosis for years because it may not be their period itself. So they may seek help from someone else first, GI doctors or another specialty, before finding any answers. And you should all know that the average time to diagnosis is actually 10 years, which is pretty terrible for something so destructive, right? It's more common in families, and even in mothers and daughters may have different symptoms. So my own story was strong family background, terrible periods, early hysterectomies. My grandmother at 24, my mom at 30, around 30. And I remember being told at 17 by a gynecologist, oh, your uterus is tilted back, you're never gonna get pregnant, and you need to just be on the pill forever. And I left the office in tears, and I never wanted to go back to the gynecologist again. So that's not a good way to start a young woman's life off, right? Through my 20s, I had chronic diarrhea, weight loss, all kinds of nausea, bowel symptoms, rectal pain, but my periods were okay because I was on these pills. And so even with my own family, it didn't seem like it was the same. It didn't seem like endo. So I actually didn't correlate anything with it. And I went to several GI doctors, several colonoscopies. I was put on an antidepressant for my bowel, which of course is really humorous and didn't work at all. Made me feel like I was in the clouds and did nothing for the endo of my bowel, right? Later ruptured my appendix, had a bowel obstruction. It wasn't until I was actually a resident in OBGYN, which this is pretty pitiful for someone in the medical field. I was pre-opping Dr. Sechkin's patients actually and asking them questions, and I realized, hey, some of these guys have my story actually. They don't have the same painful periods and they have a lot of bowel symptoms, and it wasn't until then that I worked up the nerve one day to pull him aside after surgery and talk to him a little bit about it. And I'm always indebted to him, and you'll see as the night goes on. But imagine this, someone in the medical field, again, taking 10 years for my own diagnosis. My own story continued with a lot of fertility issues, close to something like 10 rounds of IVF, I don't know how many it was. Threatened early ovarian failure, surrogacy. We lost the baby 4 months into a surrogate pregnancy. There was so much stress and tears and hope and then loss over and over, and it was very destructive. It wasn't easy. Being told I couldn't have a baby when it was the one thing I wanted became a literal obsession for me. Everyone around me knows it. You name it, I tried it. Hypnosis, hormones, retreats where you grab your baby from the sky and bring them down. I went to everything you can imagine to try to get this baby, right? I called adoption agencies, one of those fell through. I talked to the NICU, I said, if you hear of any babies, tell me. It was literally my obsession, and I took 30 supplements a day, I ate all these quirky diets. I did all of this while being a resident and working probably 80 hours a week, and it wasn't easy, and I'd be lying if I said it didn't impact my decision not to do fellowship, and I ended up giving up obstetrics for good because I felt like I couldn't deal with all of the loss and come there and be unbiased and be a level-headed obstetrician that has both mom and baby at heart. And this is the part where for me, endo was actually changed decisions in my life, changed course pathways that happen. And so it's an impactful disease. It really can alter things for you. But the story doesn't end bad. We'll have more later on. And I'm gonna hand the mic back over to Kiana to continue on.